For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October.
Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at these locations statewide.
There are no polling places.
So be sure to mail your ballot by October 27th. Hawaii votes by mail.
Well, aloha and happy Monday. I'm Ryan Kalesuji, joined by Yunji Denise. This is Spotlight Hawaii, a conversation brought to you here on the platforms of the Honolulu Star-Advertiser by the Office of Election. And of course, we remind you that ballots are currently out. You should have received yours in the mail and that there is still time, of course, for you to make sure to get those in the mail. That deadline is October 27th. We'll also be speaking with Scott Nagel later this week to discuss other ways that you can vote. But again, we want to encourage all of you to get involved and vote and make sure to get your ballots in the mail as soon as possible. Yunji, we will continue our conversation this morning, however, with another special guest.
That's right. We're so lucky to be joined by Governor David Ige, and we've got so much to talk about because, of course, Trans-Pacific travel did reopen on Thursday. We have been seeing, much more than expected when it comes to the travelers coming in, 10,000 on day one alone. So, Governor, good morning. How do you think it's going?
Good morning. Thank you, Yunji and Ryan. Thank you again for giving me this opportunity. It's really exceeded all of our expectations. We were expecting between 1,000 and 2,000 travelers in addition to the normal traffic. And as you said, we had over 10,000 travelers on the first day. And through the weekend, we received more than 8,000 travelers a day, which was more than double what we anticipated.
We still know that there is some questions about the neighbor island traveling and that there are still talks that are happening with the mayors. Can you sort of give us an update on where some of that stands with this additional test and the conversations that you're currently having with the mayors as they are different for every county?
Yes, we have implemented, and both Kauai County and Maui County have implemented pre-travel testing programs for inter-island travel. We'll be announcing today, Ryan, 8 trusted testing partners here on Oahu who have agreed to participate. For those traveling to the neighbor islands and wanting to avoid the 14-day quarantine, they can get a nucleic acid amplification test here on Oahu 72 hours prior to traveling so that they can avoid the quarantine. We continue to talk with, I had a couple of discussions with Mayor Kim from Hawaii Island, and we continue to find a way to implement the program on Hawaii Island as well.
Well, Ryan and I obviously have a special interest in Hawaii Island because both of our mothers live there. So I just want to get some clarification. Why has that island, why has Mayor Kim been so reluctant as compared to the other islands?
Yunji, one of the challenges on Hawaii Island is that they are seeing a surge in cases. And, when you look at the per capita number of cases, they actually have been above Oahu numbers in probably the last 3 weeks. And, Mayor has been very focused on the clusters of cases that they're seeing. We've significantly increased testing on Hawaii Island. And as you know, he did choose to implement a separate test upon arrival. And so they have been focused on that and making sure that we can implement that before we expanded that to inter-island travel.
When you're looking at some of the numbers, especially with those coming from out of the state, what was sort of the breakdown over the weekend in terms of the volume that were coming in and how many people were participating in this pre-travel testing compared to those who are deciding to go with the 14-day quarantine and did not get the testing? Do you guys have any sort of indication on how sort of the differences between those numbers?
One of the reasons, Ryan, that we wanted to implement this program is we felt that it would be better for those travelers coming into the state to have been at least tested prior to arriving here in the islands, and so that we know that they are negative for COVID-19 at least 72 hours prior to getting here. We've had overwhelming response. More than 85% of those traveling, 80 to 85% have chosen to get tested prior to arriving here in the islands. And so that participation rate was significantly higher than we had anticipated.
Let's get to Matt Lopez's question. Can we also enforce a COVID test when our visitors arrive at Honolulu Airport as well? Do you anticipate a time when the city and county of Honolulu will be able to have the double testing that the neighbor islands are now enforcing?
Yes, yeah, I've been working with Mayor Caldwell, and he has made arrangements for a state-of-the-art testing trailer that we've actually located already at Honolulu International Airport. They believe that they can process up to 10,000 tests per day, and that they can do the tests within 3 hours. So, you know, we are working with the mayor, trying to think about how we would incorporate that into our testing program, you know, and what the process would be for someone who didn't get a pre-travel test to be able to test out of the quarantine once they get here.
You know, one of the other questions, going back to some of those who are participating in this pre-travel test and those who are not, one of the questions that we had was, you know, how the state is tracking those that are allowed through the state through the pre-testing program and, you know, allowed to, of course, not be in quarantine, and those who are opting out and are having to do the 14-day quarantine. It has become difficult to distinguish the differences between these types of groups of people, and, you know, how is the state sort of managing those who are taking the test and cleared and those who are not?
So a couple things, Ryan. As you know, my order requires everyone traveling into the islands to complete the State of Hawaii Health Form. And we went totally digital about 4 weeks ago, requiring everybody to fill it out online prior to arrival here. And what we've been building now, so we do have a record of everyone coming into the state and what their status would be, you know, when they are scheduled to arrive here and when they would be departing, and what their status is, whether they are exempt because they work for an essential business and are coming here for work purposes to perform essential duties, or whether they are participating in the pre-travel testing program, or whether they are subject to quarantine. So we would have the ability now to anyone who has a smartphone that we could ask what their status is, and they can generate the documents. If they were part of the pre-travel test program, they would be able to show whoever stops them their test result and demonstrate that it's negative, and therefore they would not be subject to quarantine. You know, I think that that's part of the program, and you know, and that system is live in real time. So as people are entering the state, we do acknowledge that they've arrived here, and then we can get their status at any time.
What does that enforcement actually look like? I know that just anecdotally hearing from others that on Kauai, for instance, you know, they have officers actually going to the homes of people, or going to, you know, the areas of residence where people are supposed to be quarantining and physically checking. For some place like Oahu, we just have too many people. I can't imagine that HPD can take all of that on. So what does enforcement actually look like?
Well, so Yanji, you're right. It does vary from island to island. And, you know, for example, when so now we do have this digital platform, and we can keep track of the numbers here who are subject to quarantine. In development last week, when I looked at that website, I think Kauai had a total of 40 people who would be subject to the quarantine at that point in time. Oahu had 10,000 people. So clearly the order of magnitude is different. You know, we do make efforts to enforce. The county police in each island has been working to enforce the quarantine. You know, we've been working to enforce the mask orders and the other physical distancing requirements that we put in place. But clearly the challenge here on Oahu is significantly greater than in any other county across the state.
Do you foresee a time where we will no longer, excuse me, need where you would be lifting this inter-island quarantine, or do you think this testing that we are seeing the mainland travelers do, and that we're now requiring those residents to do to go to neighbor islands, do you think that that could ever be lifted in terms of the 14-day quarantine as a whole?
Certainly, Ryan. I think it's two separate questions. Inter-county, we are looking and monitoring the trends. And as you know, the number of cases and the new cases here on Oahu has been trending lower for the last 4 weeks. And we do anticipate if we keep on that trend, it could be possible before the end of the year that the inter-island or inter-county quarantine would be ended, because the virus activity in each of the counties are similar. You know, the inter-island quarantine was put in place because Oahu was surging and the other islands didn't see those number of cases. And so, you know, we are optimistic that if everyone continues to wear their masks, wash their hands, watch their distances, we would get to a point that the inter-island quarantine would not be necessary.
Alms Lee at 1033, Ryan, has a question, and this refers to an article in today's paper. I believe it's the front headline right now on the website. Why are you implementing a grace period and allowing travelers that have been tested from a non-partner? I know there was some confusion with some travelers who came in and they did get a PCR test, but it wasn't from someone that was sanctioned by the state, and they were let in anyway and not having to quarantine. Can you explain the decision to do that?
You know, certainly, Yanji, as we had prepared for October 15 last Thursday, and we were looking through the different scenarios, you know, the team had come to me and said, okay, what happens when somebody shows up and they have, and it looks like a valid PCR test from a legitimate laboratory, what do we do about that? And so I did make a decision that, you know, we're in transition. This is a brand new program that we had rolled out. It could be that some had made arrangements prior to us announcing the Trusted Partner Program. And so I did give those screening the discretion to really, you know, I asked them for a couple of things. One, to try and validate the test. We wanted to make sure that it's a legitimate test, that it comes from a laboratory that seemed legitimate, and it was a PCR test. Because of the fact that it was the first day, and there may have been an instance where people were not aware that it wasn't, that the test did not, or well, it was a requirement that it come from a trusted partner. I did give the screeners the discretion to make that decision. We did that for a few days, but at this point forward, you know, it will only be those tests from trusted partners that would be accepted.
You know, we are seeing some questions about specific businesses that are now not allowed to operate because of the mayor's current order. So we want to address, of course, the broader question of the tier system, because we know that the mayor is sort of the one responsible for the opening and closing and announcing, making those decisions and announcement based on his tiered system. But on a broader scale, how do you think the mayor's tier system is going? And, you know, we are sort of on the verge of entering into tier twos later this week. Are you at all worried that with, you know, increase in numbers, we could go right back down to tier one, and what that's going to do for businesses?
You know, I think we're all committed, Ryan, to reviving our economy and keeping our community safe. It is a balancing act, I think. You know, that we look at the case counts, the status in our healthcare system, and, you know, number of COVID patients in hospitals and ICU units. So, you know, the state did work with Mayor Caldwell and Mayor Kawakami to develop the tiered system, and we fully support it. You know, they are looking at different ways. You know, what we've tried to do, Ryan, and it's the best practices from public health leaders. We did embrace the Johns Hopkins public health model and the model for evaluating risk of activities and business, and really looking at are there ways to implement guidelines and procedures to reduce the risk. And so the tiered system is focused on allowing lower risk activities first, and as we get the virus counts down, to allow more and more risky activity. Clearly, the most risky super spreader events are really those mass audience kinds of things, sporting activities where we have thousands of people. It's very hard to maintain control in those situations and to reduce the spread of virus. And those activities only become available as we get lower and lower virus counts.
Let's talk about, let's shift gears a little bit. Malcolm wants to know, what's the status of employee furloughs and or layoffs? Of course, we're all waiting on a second CARES package. Nancy Pelosi is currently in talks, we understand, with Stephen Mnuchin from the administration. How things happen in Washington could obviously impact here in Hawaii how much money is available. But absent another CARES package, what do you say to Malcolm in terms of furloughs and layoffs for the state?
I wish that we didn't have to look at furloughs or layoffs for state employees. The budget situation is very bad. We are in a budget crisis. Right now, we are getting about 25% less in tax revenues than the size of government. So, we have an annual deficit that we're looking at between 1.3 and 1.5 billion dollars every year. And clearly that's not sustainable. So we are going to have to reduce the size of state government in a way. I wish that it wouldn't impact employees, but for the most part, most of the cost of state government is personnel cost, and we are negotiating with the collective bargaining representatives to see how we can move forward. Even if there is another CARES Act packages, we definitely have to right-size state government moving forward.
We've seen, of course, over this time, a number of different types of programs that you folks have sort of rolled out, one of them being the rental relief program. Can you sort of give us an update on that? We know that there was an initial call to action and a lot of applications came in, and we are hearing from some people who are still waiting on that. Can you give us an update on specifically that rental relief program?
Certainly, the Hawaii Housing Finance Development Corporation has been working with our private sector partners, AUW and Catholic Charities, to really help facilitate moving the funds out. I think both organizations have made tremendous progress over the last week. They've identified some of the things that was challenging, being able to verify who the landlord is. Sometimes the tenant really doesn't know who the landlord is because they're working through a management agent or other kinds of things like that. So, we're getting better. They are processing more applications. We're helping them hire additional staff so they can go through the applications that they've received. And I think we've seen a significant increase in the number of applications approved and money getting out into the community. So I really want to thank everyone for their patience and just let you know that we are trying to get the monies out as quickly as we can. But it's unfortunate that there are bad actors in their community that looks at these situations and tries to defraud the government. And, it's a balancing act about how can we identify those who are truly in need and support them and keep the bad actors out from taking taxpayer dollars inappropriately.
Well, and on the subject of assistance, we understand that there is a new program that you wanted to talk about this morning that we'd like to address, which is increasing the buying power of people who are on food stamps or SNAP benefits, as they're called. Can you tell us a little bit more about, I believe it's called the Bucks or Da Bucks, and how this program will work and who's eligible to get these benefits?
Certainly, thanks, Yunji. And yes, it is called the Bucks program, and it's an existing program, and it's really working with our farmers and the local merchants here who really want to support buy local. those who receive SNAP benefits would be able to double their purchases if they go to a local provider and they purchase items that are produced locally, whether that be fruits or produce or meats that are produced locally. So they would be able to double their SNAP benefits by going to these local vendors. So I definitely encourage everyone to go to thebucks.org and they can see the list of local vendors who are participating. And really, I think we all know that we are what we eat. And if we eat locally produced fruits and vegetables and meats, it's healthier for us. And doing this is a win-win-win for everybody involved. It helps local farmers, it helps local retailers, and it really helps those in need to stretch their dollars and help our local economy at the same time.
Yeah, another innovative program on that restaurant front and supporting farmers as well as these vendors. Of course, the restaurant card program, another program that was rolled out by the administration. We did get some comments from people who said that they were having some issues with the card in terms of setting it up. What have you heard about the rollout thus far from restaurants and businesses? And what would you say to those that might be having some problem with the activation of those cards?
You know, certainly we, apologize for any of the challenges. We are providing more information. You can go to HawaiiRestaurantCard.com, I believe is the website. And there is a phone number that you can call in to if you are having trouble activating your card, or if you want to know which restaurants are participating. And clearly, I know that I've gotten comments from restaurants that, for example, that someone wanted to go get food from a food truck. Is a question I got this weekend. And we are working on those things. You know, we are trying to keep it local, make sure that we can support local restaurants and local producers of food and meals, and trying to get through those details and bottlenecks as we come upon them.
You know, when Mayor Kirk Caldwell was on here recently, he talked about the holidays and kind of rethinking what the holidays will look like. Halloween, of course, is coming up, and the state health department has recommended basically virtual trick-or-treating, carving a pumpkin at home, basically doing all the socially distanced, safe activities. You see drive-through pumpkin patches and whatnot. As we sort of get ready for the holiday season, if you go in the stores now, I've even seen some Christmas decorations up. How do we mentally prepare ourselves? What do you think that Thanksgiving and Christmas, these holidays that are, New Year's, are big gatherings for local folks of what we're used to? How do you anticipate this will be different, and how do we kind of mentally prepare ourselves for that?
Thanks for that question, Yanji. It's funny. I was just talking about it with my family over the weekend to think about what Thanksgiving looks like, and then the holidays. We are asking people to think creatively about that. Dawn's family just scheduled a Zoom call with all of her relatives, and there are advantages. We were able to talk to some relatives on the mainland that we haven't seen for 10 years. And it's those kinds of opportunities that I think Zoom calls and virtual holidays really gives you the opportunity to connect with people that you haven't seen for a long time. So I would, again, agree with the mayor that we have to be creative as we approach the holidays. I know it's hard, and we are all social animals. For me personally, we would normally host Thanksgiving dinner and gathering for my family, and that would involve 40 to 60 people. And Dawn would usually host a gathering for her family, and that would mean 40 to 60 people. And, we've been talking about, can we organize that Zoom kind of conference to be able to connect to people and really share. And, the one advantage that I can see in that virtual conference is that you can really reach out, and, not all of our relatives can travel to Hawaii each and every year. but we were able to connect with relatives of Dawn who are in Atlanta, Georgia, and California, and Portland, all at the same time. And it was the opportunity to talk with them. And we had some of them we haven't seen for decades. So I think we need to be creative. You know, the technology allows us to reach out in ways that we normally would not do. And it gives us the chance to have the family connection in a different way. And clearly, we can't eat the roasted turkey and stuffing and all the trimmings, but we certainly would be able to share time and family time just as we would, or maybe even better than we would be normally under normal conditions.
I want to bring up another question, and this is maybe a more specific one, but we can do it a little broader as well. What tests can Canadians do? This is way confusing. What would you suggest, or what is the status for those international travelers that are trying to come in, not only from Canada, but I know also those from Asia, like Japan? What is sort of the progress on that in sort of foreign visitors coming to the islands?
Yeah, certainly that has been very complex for us, Ryan, and we are making progress. But as you know, every country has a little bit different testing scheme, and you know, the certifications of labs and those kinds of things are very different. So, you know, we are going through and, you know, working country by country to make connections with the government, try and get our Department of Health connected with their equivalent for Department of Health, and really going through and identifying, again, trusted partners so we can have some confidence that the tests are equivalent and were conducted in a way that would, you know, give us some better sense of safety and security. So we're working on Canada, you know, we're working on Japan and South Korea and Taiwan as well. And it is a little bit trickier just because of the different standards internationally. And so, you know, we're committed to recognizing in each of those major countries what the equivalent testing protocols would be and how we can certify and validate them.
Our time is wrapping up. I know that you have a call with the county mayors shortly, so we don't want to keep you here too long. But just any final thoughts you have? You know, we haven't been Interisland or in Trans-Pacific travel has been open just a few days. What's your final message to people as we kind of work out the kinks? And you know, some people still have a lot of trepidation about welcoming these visitors to our islands right now.
Yeah, so just a couple things real quickly, Yanji. You know, our Trans-Pacific travel program is a layered security approach. You know, we've implemented thermal screening in every airport. We do notice if people are traveling with fevers, and we do question them about their health status. You know, the pre-travel testing program allows us to bring Trans-Pacific travelers, and we know that 72 hours prior, they were COVID-free. You know, we have asked the visitor industry to be part of the public health network to monitor visitors' health, and if they become symptomatic, allow us to test them and get them services and help them isolate. So, you know, it is a commitment to public health, at the same time recognizing that we need to start reviving our economy so that people can get back to work. We continue to look at new ways and new tests that can give us more options, and we are committed to doing it in a way that keeps our community healthy and safe. So I just really want to thank everyone in Hawaii for sacrificing. I know that COVID fatigue sets in, and it's becoming difficult to maintain distance and wear our mask and wash our hands. But it is all of those things that we all need to take personal responsibility that will allow us to be successful in bringing back Trans-Pacific travelers, reopening schools, doing all the things that we want to do so that we can get back to the new normal.
All right, Governor David Ige, thank you so much. We know that you obviously have a very busy schedule, but we really do appreciate you continue to start your week with us and taking questions from our viewers. So we look forward to hearing from you soon, and take care. Thank you. Aloha.
Yeah, take care. Aloha.
Always interesting to hear from the governor. Interesting to hear how he's rethinking the holidays. It sounds like they are resetting their plans, and you start to sort of think of what the next few months are going to look like. He had a lot of details about the Trans-Pacific travel program, how it's working. And, very interesting, Ryan, that island by island, it's a very different experience for travelers.
Yeah, and that's right. And he's saying that they're continuing to work on some of those kinks, and they did expect some of those problems and those long lines initially as they sort of work through this. But he is saying that they are continuing to work with the mayors. They're working to set something up with Hawaii Island. He also said that later today they will be announcing 8 more trusted travel partners that people can get tested at locally, as those who are trying to travel between the counties will need to get some of this testing if you're going to Kauai or Maui or to Oahu. So though we'll look for more details coming from the governor's office later today. But we also talked to him a little bit offline about an interview that we had on Friday with Pat Sullivan and the Oceanit Assure 19 testing. And he said that they are closely monitoring this because essentially the governor is saying they need more tests. They need the opportunity to have things done more rapidly. And he's really looking forward to seeing the results. And if the FDA does approve the Assured 19 testing, that will allow the state to have something that is manufactured right here in Hawaii and service those residents to provide a more timely and efficient testing, and that they're continuing to watch that, which could potentially be a game changer with all of this travel talk that we currently find ourselves in.
Absolutely. If you missed that conversation, it was the one we had on Friday. You can look via Facebook, or the paper actually has a web page that is dedicated to this program that has archived all of our past conversations. Bottom line from that conversation, Oceanit hopes to seek FDA approval in the next 2 weeks. They are doing a saliva test that from their trials has 95% accuracy. It works much like a pregnancy test, the 2 lines. When manufactured to scale, it could be between $5 and $20 for a test, and you get results in 10 minutes. Obviously, that would be huge for Hawaii, but absent that, we obviously need these PCR tests, which are a lot more expensive and take a little bit longer to turn around. Very interesting also for, when we asked about the possibility of having a secondary test here on Oahu, he said that Mayor Kirk Caldwell has already chosen a facility for that. The test takes 3 hours, and they're trying to figure out how they would integrate that into the existing protocols, because obviously you've made folks test on the mainland. If you force a secondary test here once you arrive, how that would work, and would they have enough capacity? He said about 10,000 a day, which would be pretty remarkable.
Yeah, so I mean, as they always mention, these leaders, the mayor and the governor, this is an evolving situation and plan that continues to adapt based on new technology and new resources that become available online for them. So we'll continue to try to provide you with all of that updated information as we, of course, get them from the governor, and look forward to hopefully having him discuss more about some of the programs. And again, he did announce that new program, the Bucks. We encourage those of you who do qualify for the SNAP program to visit thebucks.org. There's a program that just really got announced today to see how you can double the amount of money you receive if spent on a local produce. So again, thebucks.org to get more information about that program as well.
A lot of you have been asking questions about unemployment benefits. We saved those because on Wednesday we are going to be joined by Anne Pereira Estacquio. She, of course, is the head of the Department of Labor and Industrial Relations. Last time she was on, she was announcing the new phone bank, so we're going to be asking her how that's going. I know a lot of people have been complaining about still not being able to reach a person and still not being able to get their claim resolved. So we want to hear from you about your unemployment issues, if you have any, and encourage you to watch us on Wednesday, because she'll be taking all of your questions. We get to do a deep dive with her for 30 minutes, which is a rare opportunity to ask all those questions.
That's right. And then we're continuing on with our conversation on Friday. We'll be talking to those that help with the EMS officials that are having to manage not only helping to protect our community, but also doing it in a time where, of course, COVID-19 is out there, and how they are responding and reacting to servicing our community in those ways. We'll also be speaking with Scott Nago from the Office of Elections to learn a little bit more about the numbers thus far in the election as we move into this, of course, all mail-in voting for the state, and what we're seeing in terms of numbers and how other ways in which you can also vote besides mail. Again, that is happening on Friday. And so we encourage all of you to continue to tune in. Thank you for the comments. We know that there are a lot of specific comments. Again, a lot of specific comments about gyms coming in here. gyms will be able to open at 25% capacity in the new Tier 2 sort of outline that the mayor has laid out. And that will sort of, if fingers crossed, Yanji, we continue to hold those numbers, will happen later this week. So we'll continue to keep monitoring those numbers and keep you posted on that. But again, we'd like to thank our sponsors at the Office of Election for bringing you this conversation.
Thank you so much for being with us. We will see you on Wednesday with the head of the Department of Labor and Industrial Relations to talk all about unemployment benefits. Until then, we wish you a fond aloha.
For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October.
Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at these locations statewide.
There are no polling places.
So be sure to mail your ballot by October 27th. Hawaii votes by mail.